Hello, good day. My name is Lou Obricker Standon, a student nurse from Davao Doctors College, and today I'm gonna return demonstrate the hair, nails, and skin. Hello sir, good day. My name is Lou Obricker Standon, a student nurse from Davao Doctors College, and today I'm gonna assess your skin, nails, and hair. So sir, I'm gonna take a moment to sanitize myself first before I start. Sir, can you dictate your name, your age, and your birthday?
I'm Anthony Natalis, 20 years old, and I was born in February 22, 2000.
Okay. So how would you like me to call you?
Just to first.
Okay, Sir Dance. Before we start, I'm gonna take some question about your present history. Okay. For your skin, sir, do you have noticed any color of your skin or discoloration? Okay. Uh, do you have any body piercing or tattoos?
Wala.
Okay, that's good. There's any trouble in your body odor?
Wala.
Okay. So, sir, for your nails, do you wear nail polish? Are your nails dry, brittle, or is there any leisure?
Wala.
Have you ever noticed changes on your nail? Okay, that's good. For your hair, do you have any do you have noticed some changes in your hair? Is there any dandruff, fleeces, or like? That's good. Do you use chemical like bleaching or coloring of your hair? Okay, that's good. For your past history, sir, I'm gonna ask about your history of your hair, nails, and skin. Do you have any problems in your hair, nail, and skin?
Wala.
Have you ever had a skin, nail, hair infection or disease?
Sa skin lang dati kung naggamit ako ng sabon. Nag-red naman.
So for your family history, has anyone in your family has this kind of illness like rashes, skin discoloration, or problem in the skin pigmentation?
Wala.
No. Okay, that's good, sir. So before we start, sir, I'm gonna ask you to remove all your jewelry, sir,
Wala akong
if you have. No. Okay, sir, that's good. Okay, sir, are you comfortable with the setting? Do you have any suggestion for like temperature or for the curtains? Do you want to close it?
Actually, comfortable with it.
Okay, sir, that's good. Thank you. So, can we start our assessment?
Of course.
Okay. So what we are trying to look here, we are trying to find if there are any sign of discoloration of the skin, if it is pallor, erythema, cyanosis, and jaundice. If it is pallor, the skin has a pinkish tone due to the lack of blood flow, and the erythema is the reddish color due to the inflammation, and cyanosis, bluish tone due to the decrease of oxygenation to the tissue that is usually indicated as hypoxia, and the jaundice, yellow tone due to the liver inflammation. So, sir, may I ask you to move your hands forward for my inspection. As I inspect, the patient has light skin to become brown, which is normal, and there is no any sign of bruises, wounds, scratches, and there no signs of any skin lesion. So, sir, the second that I will assess to you is to palpate. So, the first thing that we assess to the patient is the temperature. So, by assessing the temperature, we can use our dorsal surface to assess the patient's temperature because our dorsal surface is more sensitive to our ventral hand. So sir, I'm gonna use my dosal surface to assess your temperature. Is that okay with you?
Yes, of course.
So what we are trying to look here is the temperature of the patient if that he has fever or shock. As I assess, the patient temperature is normal. So next to assess is the texture of the skin. By assessing the texture of the skin, we can use our palmar surface to feel the smoothness and the roughness of the skin. So sir, may you raise your hand so I can assess your skin
Sure. Why not?
texture. As I assess the patient's skin, the skin is smooth. If the patient have the rough texture of the skin, it may indicate as the keratinization. Next to assess is the skin turgor. By assessing the skin turgor, we assess the mobility of the skin. So, sir, if it's okay with you, may I pinch
Yes.
your clavicle area?
Yes, sir.
Okay, as I assess the patient has no skin turgor disease. If the patient has skin turgor disease, it may indicate as the dehydration. So the mobility of the skin must return within 2 seconds, which indicate as normal. If it is slowly returned, that may indicate as dehydration. By assessing edema, we must apply some light pressure to the skin within 5 seconds. So sir, can you move your feet to mine, sir? If it is okay, but first I'm gonna get some clothes, sir. Okay, sir, you may raise your feet. You are the feet, sir. Okay, thank you. So, if the skin quickly return, there's an indication of normal. But if the skin is intended, there is a sign of edema. Okay, sir. This will be my last to assess to you for your hair. So before I assess your hair, sir, I'm gonna take the glove first to assess your hair. To inspect the hair, we must inspect the hair scalp if there are indication of dandruff, fleeces, or lesions. So sir, I'm gonna inspect your hair, sir. First.
Go ahead. Can you do some massage? Can you talk with-
Okay, as I inspect the patient's scalp, there is no sign indication of dandruff, lesion, and fleeces. So the scalp patient or the hair is normal. Okay, sir. The next is I will to assess to palpate your hair, sir. So to palpate the hair, by assessing the texture of the hair, you must take a strand and roll. So I'm gonna assess your hair, sir.
Okay.
So I'm gonna take some strands, sir.
Okay.
As I assess the patient has a normal distribution of the hair, which indicate as normal. So after performing the assessment, we must perform the proper hygiene. Okay, sir, that will end our assessment, sir. So I will indicate what are the findings that I've been assessing. So for your skin, sir, there is no skin discoloration, and there is no bruises, lesion, and any kind of infection. And for your nails, sir, your capillary fill are normal, and the tone of your nails is pinkish, which is normal. And for your hair, sir, there is no loose strand, and there is no dandruff to be seen and thesis. Okay, sir. Is there any question for you, sir, or clarification that you would like to suggest?
So far, wala naman.
Okay, sir. That will end our session, sir. Thank you.